Good morning, everybody. My name is Dr. Tariq Abdelgawad. I'm the Medical Director of National Rehabilitation Center in Abu Dhabi. I'm very honored and pleased to introduce this plenary session. It's always a pleasure to introduce the dear colleague and friends. Both of them are working for the United Nations organization that is responsible for the in different ways, sometimes in a collaborative, many times in the collaborative way for the problem of the addictions. The first speaker for today is Dr. Vladimir Poznyak. Vladimir is the head, the unit head of the Alcohol and Drug and Addictive Behaviors Department of Mental Health and Substance Use in the World Health Organization in Geneva, Switzerland. And in that role, he is responsible in coordinating and implementation of a wide range of activities on alcohol and drug policies, prevention and treatment of substance use disorders and related health conditions, public health dimension, prevention and treatment, substance use disorders and related health conditions, public health dimension, and gambling and gaming. Dr. Poznyak has been in the forefront of the WHO Secretariat work in support and development and of implementation of the World Health Global Strategy to reduce the harm use of alcohol, Global Alcohol Action Plan in 2022 to 2030. The 11th revision of the International Classification of Disease for Disorders due to Substance Use and Addictive Behavior, collaborative program with the United Nations Office on Drug and Crimes, UNODC, on drug dependence treatment care. He has coordinated several large international research projects implemented under the auspices of the WHO in such areas as injection drug use, alcohol and injuries, drug-dependent treatment and HIV, AIDS, screening and brief intervention of substance use. Prior to joining WHO headquarters in Geneva, Dr. Poznyak has served the program on alcohol and drug use of the WHO regional office in Europe, in Copenhagen, Denmark, on several times and on a limited appointments. He is a medical doctor with a specialization in psychiatry and PhD in addiction meds. Dr. Poznyak has published extensively also in high-profile journals on public health, substance use and addictive behaviors, mental health. He has received several international awards, including the International Award of Excellence in the International Leadership from the National Institute of Drug Abuse in the United States of America. It's a pleasure always to introduce you.
Thank you. Thank you very much, Tariq. I feel a bit embarrassed after such a long introduction, but first of all, I would like to thank all of you for coming so early at 8 o'clock for this session. In my presentation, along with the title of this conference, Uniting for Meeting Challenges of Addictions, I will update you on the recent activities of the World Health Organization with an objective to open up opportunities for partnerships, for collaboration, for unification of our efforts in complementary way to address addiction. So let me remind you about the main functions of the World Health Organization, which are to be the coordinating body in international public health. And we have several important key functions, including the articulating evidence-based policies, providing normative guidance, setting standards, monitoring health trends. And our mandate is given by WHO member states at the meetings which are taking place twice a year, and the main one is World Health Assembly in May. In fact, in just 1 week time, this year World Health Assembly will convene in Geneva, and there are many, many important issues on the agenda. Of course, some of them are related to the health emergencies, which are now not only COVID-19, which was a tremendous, this pandemic had a tremendous impact on health systems around the world, but also the conflict zones, including in Europe, and many other issues. But also, if to speak about our area of work, the World Health Assembly will consider several important documents. First of all, action plan to effectively implement the global strategy to reduce the harmful use of alcohol. This is the second time after 2010 when World Health Assembly will consider alcohol policy issues. And if adopted, this action plan will shape significantly the activities of member states, secretariat, partners, and civil society organizations in this area. The second one is a report of the Director General on the world drug problem. And there is a decision in this report which requests the Director General to report every second year on the work of WHO in the area of drugs. And the third important document is the Global Health Sector Strategies on HIV, viral hepatitis, and sexually transmitted infections, which pay a lot of attention to harm reduction interventions for key populations, including injecting drug users and other users. Currently, the World Health Organization is in the process of implementing the General Program of Work with 3 key objectives, strategic targets that were set by our senior management and Dr. Tedros, our Director General. To have 1 billion more people, healthier populations, so with better health, to have 1 billion more people to be protected from health emergencies, and here it's about COVID-19, about conflicts, about humanitarian settings, and third one, to have 1 billion more people covered by universal health coverage. And of course, the emergencies in the recent years has been a very strong focus of the organization. We, from the very beginning, when COVID-19 pandemic has started, was announced by the World Health Organization, we provided operational guidance on essential services during the COVID-19 pandemic, and some services for mental health and substance use disorders were included. And WHO monitored disruption of all key services, not only substance use and mental health, of course, but all others, in 3 waves of data collection from member states. And you can see from this slide that disruption of opioid agonist maintenance treatment, harm reduction services, overdose prevention and management services were very substantial at the beginning of the pandemic. This report was published in February this year, and it still shows that these services at the end, in the last quarter of 2021, were significantly disrupted, and on the top is, in fact, services for alcohol on the second on this list, and also the many others which are essential for provision of health services for people with substance use disorders were disrupted in more than half of the countries reporting on this function. Let me briefly say what are the main areas of work, because this conference is largely focused on drug-related issues, and what are the main areas of WHO work in this area. First is prevention of drug use and reduction of vulnerability and risks, and this is largely within health systems, but health systems in a broader understanding of the concept. Second is treatment and care of people with drug use disorders. Third one, harm reduction, prevention and management of the harms associated with drug use. Access to control medicines, to those medicines which are under international control and which are essential for provision of health services. And finally, monitoring and evaluation. If to speak about the prevention, I have to mention the important role of WHO in international regulations of psychoactive substances, because this role is given to WHO by drug conventions of 61 and 71, and through its expert committee on drug dependence, WHO provides recommendations to Commission on Narcotic Drugs on international level of control of psychoactive substances, including psychoactive medications. And you probably may recall that recommendations on cannabis which were delivered to CND, and some decisions were made in this respect. Also, in prevention, when we are talking about prevention in WHO, our focus is not very much specific on drug use prevention, but more in general on prevention of mental health problems, on increasing resilience to factors which are important for development of substance use disorders. And with this regard, many programs are involved in this work. Our Child and Adolescent Health Department, together with UNICEF, produced many documents. Some of them are mentioned on this. And of course, we work with UNODC, our long-standing partner, on that. If to speak about primary prevention, our particular focus is on screening and brief interventions and referral to treatment in health systems. WHO has pioneered this work on alcohol many years ago, and afterwards with the CIST package on drugs, and this is something that is definitely one of the priorities for organization. One issue that is a bit neglected, despite significant demand for this area and its potential for prevention of drug use, is road safety and drug use. This is a very complex area, very important one, and unfortunately, it's not well reflected in the activities of international organizations. Just to inform you that in several months' time, we release the second edition of the Health and Social Effects of Non-Medical Cannabis Use, which will be an update of scientific evidence on medical and social consequences of non-medical use of cannabis. The previous edition was released in 2016. Important work that I mentioned already, that for universal health coverage, one of the key priorities is to distribute interventions for mental health and substance use disorders across different levels of health systems, with a particular focus on primary health care. WHO several years ago released the so-called MH-GAP intervention guide, which is focusing health professionals in non-specialized healthcare settings, so largely primary health care. It contains all algorithms and interventions and guidance on interventions for all major mental health conditions, including substance use disorders, both alcohol and drugs. Currently, WHO, our department, is in the process of updating the evidence for these recommendations, and we plan that next year this will be released. Important issue is related to introduction of ICD-11 from 1st January 2022 in all countries. And I want to again to flag that NRC here in UAE and the government of UAE provided important support for developing of this of ICD-11 when it comes to disorders due to substance use and addictive behaviors. This is a major step forward in comparison with ICD-10, and it has much 17,000 terms, because it covers not only as DSM-5 mental health conditions, it covers all areas of healthcare with all codes. It has more than 100,000 terms which are recognized in the classification, and it's fully developed to be integrated with electronic health records. Again, with NRC, we are planning a substantial training program that we'll be able to roll out for countries to make appropriate diagnosis, because it's not just to read, it's not a trivial thing. There are many issues which need to be taken into consideration when you are making the diagnosis of this or that condition. Some of them are new in ICD-11. There were never before in ICD-10. There are new opportunities for monitoring classes of psychoactive substances, and I know that in NRC there is an excellent laboratory that allows to, in fact, identify all these new, in red are those classes which were new in ICD-11 in comparison with ICD-10. And again, this is a future when laboratories in many countries will allow to do that, and you can make more specific diagnosis, which will, of course, is critical for management and critical for monitoring what is happening in countries, in municipalities, in populations. Recent development with the support of French government is a WHO Academy, which is it's a very ambitious plan of doing multi-open access, multilingual, web-based platform for delivering training for health professionals, with an ambition by the end of 2023 to reach 10 million people. We are now working on 2 modules on that. One is for MH gap recommendations, which I mentioned, for mental health and substance use conditions for WHO Academy. And the second module is on health risk factors, which for largely in the context of prevention of non-communicable diseases. And here we are responsible for alcohol module on brief interventions for health professionals, but the whole training package will cover tobacco, alcohol, diet, and physical activity. So it will be ready somewhere in 2023. And of course, our collaboration with UNODC on demand reduction, and I would like to thank again State Department and ILL program for continued support of our collaboration with UNODC, because we were able to produce some documents which were key, which were recognized by governing bodies of both Commission on Narcotic Drugs in Vienna and WHO governing bodies, and by international community. Many of them are well known, used in the countries. In WHO, we did, with collaboration with UNODC, extensive field testing. Also, the Stop Overdose Initiative. Unfortunately, I don't have time to show the movie that we produced for results of this project. And we recently co-leading the Interagency Technical Working Group on Drug Prevention, because interagency mechanism for drug demand reduction was absent within UN system and intergovernmental organizations, though existed for other areas. And with Giovanna, I think we filled this gap, and she will talk about that later. What are specific activities for achieving universal health coverage? One is focus on primary health care, because no way to increase coverage for treatment of substance use disorders for interventions, particularly at early stages, if you don't involve non-specialized healthcare settings, primary healthcare and other like gastrointestinal, cardiovascular, cancer programs. So it's all this can work, and in each of these programs they have particular issues which are relevant to our area of substance use. Then next one is to work towards sustainable financing and financial protection. Personally, I think this is one of the key issues, key challenges that we are facing in our field, and this again needs to be addressed, and this is in general at the high agenda of universal health coverage, because one of the main principles of universal health coverage that everybody who needs help receives this help without financial hardships for the families and themselves. This is the key. If this is not respected, you don't have chances to get universal health coverage. Improve access to essential medicines and health products, to develop and train the health workforce and advise on labor policies, support participation of clients, of people with disorders in national health policies, and of course, improve monitoring. For alcohol, we are doing, in UN system, we are the organization which provides key information, global information on alcohol and health. We have global information system on alcohol and health. We publish periodically reports on alcohol and health. The next report will come this year, but it will be integrated with drugs, and I will talk about that a bit later. What is next? So this year, we will release, though with some delays, but because of COVID and many other things, the global WHO report on progress with attainment of SDG Health Target 3.5. And again, I appreciate the support and collaboration with NRC on producing this report, because that would be, in fact, it will have 2 parts. One part would be all data on health consequences of alcohol and drug use, WHO estimates, not ICME, which are published in The Lancet, but WHO estimates, which are consulted on these estimates. We consult with member states. So they are the data which goes into these estimates are validated by governments. And we will produce on estimates on alcohol and drug-attributable disease burden, with number of deaths, with number of dailies, etc. And I should say that in drugs, we are far. For drugs, the figures we already produced in the report, 2 figures, in the report by Director General to the World Health Assembly. One is number of deaths, it's close to 600,000, And second figure is that 14,000 due to cannabis use. It's the first time when cannabis-related deaths crossed the threshold of 10,000. Largely due to, but it's only two figures. In the report, we will release much more. But also, the second part of the report will be about the role of treatment, a role of demand for treatment and service coverage. And we will introduce, now we're submitting for publication the methodology paper. That will be first cross-country estimates of treatment capacity. We introduce service capacity index. For substance use disorders, that will be comparable data across member states. And again, now this data will allow to benchmark the capacity in treatment systems and with other normative documents to move it forward. The next issue that we will have is we are planning a global, and I think in this conference it's important to acknowledge what we need is to consolidate our efforts for advocacy for prevention and treatment of substance use disorders and disorders due to addictive behaviors, to reinstate, or in fact to establish the parity with mental health and physical conditions. And it has huge impact on demand for treatment, on position and well-being and professional satisfaction of health staff involved in that, on many, many aspects of our work. And this is something, as well as funding, this will be important areas. Also, we'll affect stigma. We plan to address stigma and discrimination very strongly. And we, of course, we are looking with UNODC to continue implementation of standards, international standards for drug use disorders with our partners, and of course, this quality assurance mechanisms with UNODC. We've been working on that. Also, we made an important contribution, in fact, for that, but I think Giovanna will address it further. Country-level work. Now, our senior management requests, even headquarters, because we were traditionally, we were focused on normative guidance, policy development, etc. We have a strong request now to provide integrated through 3 levels of organization, region, country, headquarters, to move to countries. And one example is Special Initiative for Mental Health, which is implemented in 8 countries right now, with significant support from major donors. So that means that substantial funding is available in each country for that. Substance use disorders is now a Cinderella, as always, sometimes in this program, but that will change. We are already working on some countries. Finally, colleagues, I would like to invite you to the WHO Forum on Alcohol, Drugs, and Addictive Behaviors that we held every second year, and next one would be in 2023. Thank you for your attention. We look for the partnership to address the challenges of addictions. Thank you.
Great as usual. Keeping the time, and I don't know how you do it with all such achievements and aspiration of the not only the WHO but the whole world. And we are pleased at the NRC to continue our cooperation and support, and thank you for the acknowledgement. Our second speaker is Ms. Giovanna Campello. She has more than 25 years of experience in the United Nations Office on Drug and Crime in supporting member states and stakeholders at all levels in improving their drug prevention response, applying and contributing to scientific evidence. In this context, she has led the publication of the International Standard of Drug Use Prevention in 2013, and the United Nations WHO second update edition in 2018, like what Dr. Poznyak was referring at. Since 2016, she had been leading the prevention, treatment, and rehabilitation section, the supporting evidence-based, gender, and human rights sensitive practice on drug prevention, treatment, care, and rehabilitation, as well as access to control medicine. I'm very pleased to introduce Ms. Giovanna Campello.
Thank you, Mr. Chair. Thank you all distinguished delegates and fellow friends, colleagues, and participants that made it at these very early hours. Thank you for being here, and thank you for having us. What I will try to do in the next 20 minutes is to pick up some parts of our really comprehensive field, covering prevention, treatment, care, recovery, and some parts that are taken from our work, but where I think partnerships and collaboration would really make a difference and is making a difference. This list is by no means exhaustive, but is just meant to provide some food for thought, some ideas for future collaboration, I hope, and to really, as Dr. Poznyak was mentioning, move our field forward. We have achieved a lot, but we are greedy. We want more. And why do we want more? Because we want to care for the health and well-being of people, including people with drug use disorders, of course. This is my conflict of interest and learning objective. My first example, those who know me a little bit more know that my field, I come more from prevention. So my first example is very much from the prevention field. And you all know that we have been working for many, many years around parenting skills and family skills. Why? Because we know from the science that these kind of interventions have been found to be effective in preventing drug use. But as Dr. Poznyak was mentioning, together in a collaboration with WHO, we know that these kind of programs do much more. They have collected the science systematically, and we know that family-based prevention is also effective in preventing violence, particularly youth violence. It's effective in protecting children from child maltreatment, and it's effective in supporting the development of children and their mental health, also in very difficult circumstances. And I am underlining this because this is what I would like to talk about particularly. When the pandemic struck, we found that these kind of programs were one of the most important pillars in supporting parents and families and children under stress. And unfortunately, as you know, it's not new, but the world has been struck by huge humanitarian crisis. And we have found that these kind of programs are very effective in this field as well. And I think that this is a field where working together, we can really make a difference. It's a field where people are extremely vulnerable because circumstances make them vulnerable, and we can make a difference for their health in the moment and in the future. So, for example, we have been working, we have started to work, you see the picture on the left, in refugee camps, together with UNHCR, another example of collaboration with Rohingya refugees in Bangladesh. And in the super cute babies that you see on the right are from a refugee camps in Jordan, where we are including parenting tips in a vaccination app so that parents get these ideas on how to take care of their babies more effectively on an ongoing basis. And these are just a couple of ideas. We also distribute parenting tips in the baskets of, in the bags of bread that are distributed in the refugee camps, where we can, of course, we do group work. But these are just many ideas of things that can be done to build the resilience of children and families under stress. And I think that together with WHO, together with UNICEF, together with UNHCR and IOM and all of you, we can do so much more. This also links to our work on treatment. We have been working on, together with WHO and UNHCR, on creating a package that can be used to address substance use disorders, to care for the health of people who use drugs, people with drug use disorders in displacement, so people on the move or in refugee camps. And I think that this is really, really needed. And we have been most recently very active in 2 humanitarian crises in Afghanistan and in Ukraine, building the resilience of families and ensuring the continuity of services for people who use drugs and people with drug use disorders. I think that it's a good start, but we can do so much more. And I'm hoping that I'm inspiring you to think together on how to address this population that is in extremely vulnerable circumstances. Let me see. Yes. Dr. Poznyak was already alluding to it. You have it in your program. I will not speak too much about this, but together with WHO, we have developed the international standards for the treatment of drug use disorders. And one of the tools that we have been working on since 2016 on how to disseminate the standards is bringing people around the table for quality of treatment. This is a very basic way of saying something very, very deep and institutional, which is to create quality assurance mechanisms so that services get better and really cater for the health and of people with drug use disorder. And I will only mention this because we have seen still too many human rights abuses that are perpetrated in the name of treatment, and this needs to stop. And I am very honored that we have been able to work with many of you, with WHO, with INL, on developing this kind of tools. And today, this will culminate in the launch of the consortium. So I will leave the thunder to Annette, because this is really where our tools are taken and brought forward to a new level. And also because I don't have much time, and there are other places where I think collaboration is not crucial, is essential. It just doesn't happen. And one of the fields where we have been working, where partnerships need to go to another level, is in the collaboration between health and justice. We all know that people that are in contact with the criminal justice system, especially if they are in the prison setting, their health and well-being is much worse than that in the general population. And I'm giving here some very basic but very striking figures that have been published by the UNODC, by our colleagues in the World Drug Report, where you can see how drug use in prisons level are much higher than in the general population. And we could have very similar figures for mental health, for HIV and many other kinds of physical and mental indicators. And the fact that this is much worse for women that found themselves in prison much more than men for drug-related charges. All of this is a situation that we can address. We have the tools. We can provide treatment as an alternative to conviction and punishment for people who use drugs and people with drug use disorders. If there is a need for people to be in prison, we can provide health services, especially mental health services, and including treatment for drug use disorders to address this situation. We don't do it. Yes, it's a matter of resources, but it's also a matter of the fact that the criminal justice system and the health sector very often do not speak to each other. And we've been very honored to, after the publication, do I have the publication? No, probably not. We have published a first overview of possibilities and alternatives together with WHO in 2016. And we've been very honored to go around in countries and sit around the table and say, what can we do about this? And very often, these were people that had not been really sitting around the same table ever. And this needs to change, because otherwise the health of people with drug use disorder that are in contact with the criminal justice system will just fall in the crack. And there are many experiences that are being presented in the context of ISSUP, on the context of alternatives, that I really, really invite you to listen to and learn from, because this is a way forward that we need to collectively develop much, much more. Because it works and is cost effective, by the way. Another things that we have seen, and this is an example that I want to bring to you, where collaboration makes an enormous difference, is our SOS studies that Dr. Poznyak already mentioned. Our Stop Overdose Safely study trained 14,000 people in 4 countries, in Central Asia and in Ukraine. These 14,000 people were people likely to witness an overdose, which meant, of course, police and first responders from the emergency service, but also meant people who use themselves, their families, their friends. And it's a very basic training on how to use naloxone safely. We equipped them with naloxone, and we studied what happened. We saw that the naloxone was used during overdose, was used correctly, and we saved lives. And this is great, because we demonstrated that take-home naloxone is feasible also in low and middle-income countries, and not only in high-income countries where the evidence was coming from. This is all great. What I think is even better is some of the qualitative experiences and testimonies that we have collected from the people involved. Remember what I told you, all of these people, emergency, police, people who use, their families, they had never been in the same room together, and they had never been in the same room in a collaborative setting. Maybe they were in the same room, but the police was having a problem with the user or with the family. No, in this case, they were all in the same room to cater for the health of the person who used. And you can see what the testimony says. I used to think that everyone was just waiting for us to die. After all, who needs those addicts? But this program showed us that no, somebody needs somebody needs us. Somebody cares about how to save my life. And another person said that my neighbor was found unresponsive. I knew how to do, and then soon all of the families from the neighborhood reached out to know how to help. And this, for me, is an example how a simple intervention that brings people together can change so much more than many trainings, really the minds and hearts of people, and make a difference to the health of our target group, our people, the people with drug use disorder. So I think we should think as much as possible more and more in this particular way. How much time do I have? I take 2 minutes more to speak about our international cooperation. I have been privileged to be collaborating with Dr. Poznyak for more than 10 years. Shows our age, Vladimir. But as Vladimir was mentioned, did you ever notice there is no interagency mechanism for drug prevention and treatment? HIV/AIDS has an entire interagency mechanism that has become an organization. The joint program, UNAIDS, is an interagency mechanism for AIDS. And for drug prevention and treatment, there is really nothing. And we had been collaborating for 10 years, and we say we want to bring this to the next level and enlarge and create an interagency mechanism. We are starting small. Okay, we are starting with an informal, light, and practical technical working group. We have big ambitions, but we are starting really, really light. And we have more than 15 interagency, international organizations with us already. We had our first meeting in February, and many of the organizations that are represented here are also part of the working group. What we want to really see is a substantial increase in interagency coordination and collaboration. And I hope I have given you enough examples of why this is important and why this can make a difference. For now, we are thinking about to start to work around advocacy, about reducing stigma, as I was mentioning before, disseminating these good practices of multi-sectoral collaboration so that more and more people are inspired to pick them up, and of course, keep on doing with our work on producing normative guidance and, if on request, technical support. And so this is our start, and I hope that we will be able to join. At the moment, we are starting only with international organization. And I know that I'm speaking to a network of civil society organizations here, but just wait for us a tiny bit. When we go to concrete action, we will open up the action to all the international stakeholders, academia, CSOs, and so on. And here you have amazing examples of collaboration at civil society level that I think will make our field so strong if we only manage to join. And this is my small power conclusion. It's from a quotation from one of my favorite novels of all times, Howard's End by E.M. Forster. And the main character in the novel says, continuously, throughout the novel, only connect. And in that sense is more about connecting the meanings of life and the relationship that give meanings to life. And that's a bit philosophical, but I think it relates to us. Even if not everybody is here this morning, I know that here we are representing so many more participants, and behind us there are all our organizations. If we join forces, we can really make a difference. We can really improve the resilience of children and youth so that they grow up healthy and safe. We can really protect the health of people who use drugs and people with drug use disorder and help them to recovery. And so I hope that we continue to work together. I'm very much looking forward to. I hope I've given you some examples, and I'm looking forward to hear yours. Thank you very, very much.
Thank you, Giovanna, and the message is well received, and for all of, on behalf of all the audience, and definitely for the NRC, we will connect, and thank you. Thank you for the attention. Thank you for being early in the morning on Friday. And just an apology for Brian and Annette for taking 10 minutes. We started late, but it's over to you for the ICQ launching. And good luck.
All right, here we are. Good morning, everybody. Good morning. I want to thank our hosting partners from the NRC, also our international organizations on stage, WHO, UNODC, and the Colombo Plan. I want to very quickly summarize the remarkable developments that have taken place over the past few years with the support of the international partners and organizations here and also in the audience. We have to ask ourselves, what is the issue that we're trying to solve? Today we're launching a new organization. Many treatment services around the world are non-evidence-based. And this has given our field a very bad name. And I travel to a lot of countries around the world, visit a lot of treatment programs. Sometimes they're very well-intentioned people, but they are not implementing evidence-based practices. And in some cases, they're violating client rights and human rights. And as a result, treatment is failing in these places. Clients lose hope, families lose hope, communities lose hope, policymakers lose hope in treatment, and they start investing and coming into some radical ideas that are not evidence-based as a result, and policy suffers as a result. Ultimately, clients suffer. But there's a lot to be optimistic about. We have 70 years of empirical research that says that treatment works. It's as effective for substance use disorders as other chronic relapsing diseases. And so we really need to organize that science. So what we heard today, I want to really applaud the efforts of WHO and UNODC, because they helped the global community organize that science through their leadership in these international standards for drug use disorders. Groundbreaking. There's nothing, no other document or study or process like the one that has been undertaken. And beyond that, the international partners came together because there were also standards from European Union partners in COPOLAD and what they've also developed, and other standards out there from other countries. We then developed a process working with the international organizations, consultants, partners, to develop a further level or a further deepening of these standards with the key quality standards, which have also been now developed and released. Here's the handbook in line with the key quality standards. So that's the second level of architecture that's been developed. At a quality level, at a key level, what should every treatment facility in the world have? What's required? So where are we now? We've got two major efforts. One, UNODC is leading the advocacy for quality through policy discussions among member states at the Commission on Narcotic Drugs, assisting member states with technical assistance and programs, and a consortium of international partners over the coming years is going to focus on building and working with governments to build that infrastructure. And so I want to recognize the Organization of American States and their Inter-American Drug Abuse Control Commission, CCAD, UNODC, the Colombo Plan, the World Health Organization, and the Pan American Health Organization in being partners in constructing that infrastructure. So that will be sort of in-depth technical assistance with member states that would like to further deepen and professionalize that quality system, helping build accreditation systems and helping governments monitor those treatment programs. But second is the effort that we're here to look at today. We need to organize also that structure of how to recognize quality. And so we need an association that celebrates quality and that affiliates organizations that are in this line of work. As you know, the international partners, we all and INL, have gotten in the business of establishing and working to build that global ecosystem, the professional associations that are so important to help carry out the work that's needed in the world. In 2009, the establishment of the Global Center for Credentialing and Certification, GCCC, for the addiction workforce. In 2015, the International Society of Substance Use Professionals, ISSUP, launched in that conference that many of you attended in Bangkok. In 2016, launched the International Consortium of Universities for Drug Demand Reduction, ICU-DDR. In 2021, launched the International Technology Transfer Centers. And today we're launching the International Consortium for Quality Assurance Agencies, ICQ. The purpose is to bring together accreditation agencies or quality assurance agencies and to celebrate that quality. But beyond that, also my vision, which I hope that the new member states of ICQ adopt, is to develop an ICQ global quality seal that all members of ICQ endorse, so that when they go to their countries and they provide their accreditation to treatment facilities, saying, congratulations, you meet our national standard, if you meet this international quality standard of ICQ, you also have that seal added to your accreditation certificate or license. And in that way, you will know that that quality of this country is equivalent to the standards that other countries have also met, facilities in other countries have also met. So that, I think, is a very important way to recognize that global standard, as you would for any other medical profession. So I would also like to say, in sort of now concluding, that ICQ can not only count on quality assurance agencies, it also must include treatment facilities and programs and services as stakeholders, as a very important network. So hoping to see that also as an important component. And finally, patient advocates as well. Those that have received services are in a great position to be able to articulate where services have and had not met their expectations and needs. ICQ is launching as part of the Colombo Plan, very much like GCCC is an arm, an extension of the Drug Advisory Program, so will ICQ be. And I really encourage and invite quality assurance agencies from all over the world to join and submit an application to join ICQ. I want to conclude by thanking Annette Dale-Perera, who has been the mastermind, chief architect of quality assurance, both in consultancies with UNODC, but now in the driving force in conceptualizing ICQ as a movement, even beyond the organization. And I want to thank also the Colombo Plan team, which has really done a tremendous amount of work to get to this stage, and I know will be very active in the development and growth, particularly Dr. Mariano Montenegro, who has been leading the charge with his team. INL is proud to support and advance quality assurance in treatment. I'd say last decade was the one of really focusing on developing the workforce, and we will continue to do that. But this year, our investment, and for the next decade, our investment is going to pivot more and more to quality assurance to make sure that international standards are met now that we have these wonderful documents. And we are confident that as a result, quality will improve and ultimately the important goal of saving lives will be achieved. So with that, I want to thank all of you for being here for this momentous occasion and turn it over to the hosts. Thank you.
Hello, good morning. Thank you, Brian. Thank you, everybody. Thank you, the organization. I want to say very few words because I'm Mariano Montenegro. I'm a medical doctor. I'm a psychiatrist. I have been treating patients for a long time, and this subject means dignity. So I think we have to improve and increase the coverage. Of course, like Vladimir told us, we need it, but with quality, always with quality, because without quality is not dignity. It's not good result also in a pragmatic view. So the coverage in our subject is very low. 1 in 8, the average in the world, can have coverage in treatment and rehabilitation. 1 in 11 in Latin America and 1 in 18 in Africa. So we have a big problem of dignity. But this insufficient offer, the quality is not the best. We need to improve that. So this is our principal issues now, and we have the honor to lead this stage now from our organization, creating this ICQ. And thank you very much with INL. With this support, nothing is possible in general. Thank you, Brian Morales, for your sensibility about this subject and a lot of subjects. So we have a good news. We have UNODC, WHO International Treatment Standard. We have key standard for quality assurance of treatment and services. We have quality assurance standard of treatment services system. Having a system is fundamental part of quality, so we have to talk about that. And now we have this stage with International Consortium of Quality. So I want to introduce our fantastic consultant, colleague, and friend, Annette Dale-Perera, because she's going to show with details what does this mean. And I want to invite all of you, all the countries, because we want to collaborate with the progress of this subject. And we are completely prepared to do that, and we are very motivated for that. So, Annette, please, can you be with us? Thank you.
Good morning, everyone. And thank you for staying right to this point. I know that there's workshops coming, so we will be quick in relation to this. Thank you very much, Brian and Mariano. Thank you to Vladimir, Dr. Poznyak, and thank you to Giovanna for your previous speeches. I'd like to give you a little bit more detail about ICQ. So the vision for ICQ is that we want to create a vibrant global community hub on quality and quality assurance. We want to work in partnership with international organizations and key stakeholders to recognize, promote, and improve quality in drug use disorder treatment services. So we want to create a hub where organizations can really work together and create resources together, and also create peer-led processes to recognize quality in drug treatment. Now, ICQ stands on the shoulders of the previous excellent work that's been done by international agencies on guidelines and standards, particularly by the World Health Organization, UNODC, and multiple different stakeholders. So there's a huge amount of work that's already been done on this by many, many experts around the world. So basically what we've got is we've got fantastic, excellent evidence-based building blocks and some international consensus about what is ethical, evidence-based practice and quality in drug use disorder treatment. So we haven't really had this before today in the way that we've got it now. We've also got the United Nations Sustainable Development Goals. So we've got levers there in terms of improving the capacity and the quality of substance use disorder treatment. We've got significant work that's been done by the UNODC on quality assurance toolkits for services and systems, and as Giovanna said, significant work that's been done by international agencies and regional agencies, and indeed individual countries, on standards and on quality assurance mechanisms. We've also now got something called the key quality standards agreed by international agencies. And I think the best way to think about these is, if you like, this is the subset of standards drawn from all of these different sets of standards and guidance documents that the international agencies have agreed are the key ones that we think should be implemented by drug use disorder treatment services if you don't do anything else. So they're a very, very significant piece of work. Now, we know that the key driver, the UN Sustainable Development Goal, we're supposed to meet and improve the capacity and quality by drug use disorder treatment by 2030. It's only 8 years away. I think Dr. Poznyak made reference to this as well. So we've got a lot of goals and a lot of implementation to do before then. A lot to achieve in a short space of time, and we've all got a duty to try and do this. Okay, so what's quality? Quality is something of a known standard, and I think the previous speakers have said that good quality drug treatment that's safe, patient-centered, effective, well-managed, well-led, delivered by competent, caring staff can have a really positive impact on client outcomes. But sadly, we know that drug treatment that's not good quality will not have a positive impact on patient or client outcomes and can actually make people worse. And also, there is things that's done in the name of drug treatment that's actually an abuse of human rights. And we've got to try and tackle that. And I'm sure that everyone at ISSUP 2022 wants to provide and promote drug treatment that has a positive impact on patients' lives. We want to help patients and people with substance use disorder problems reduce the negative consequences and the negative impact on their life, overcome dependence, and achieve recovery outcomes. Okay, so this is the vision for ICQ. This is what we want to do. Essentially, we want to work with 3 key stakeholder groups. And the three key stakeholder groups are the quality assurance agencies or organisations themselves. And these organisations are bodies that may be involved in standards, registration, inspection, or accreditation of substance use disorder treatment services. And they come in a range of forms, and we're particularly finding this out at ISSUP 2022 because we've got some with us working up in a room in the back of the building. It's a long walk. It's a big building, this building. And we want to help the quality assurance agencies develop resources and also see if we can develop a peer-led mechanism that recognises when a quality assurance organisation is accrediting or operating in line with the key quality standards. Because if a quality assurance agency is operating in line with international standards, then de facto, the treatment services that pass its accreditation are also operating in line with the key quality standards if they're being met. So it's a good way to reach a wide number of agencies through working with a small number of services. We've begun to recruit the quality assurance agencies around the world, and I'm very pleased to say that we've got 6 organisations with us at ISSUP, and that's from the US, from the UK, from Chile, from Pakistan, from Portugal, and also an international organisation that's working in an additional 8 countries. The next group of stakeholders that we want to work with are drug treatment providers themselves and their representative bodies. We want to work with them to develop peer-led resources that promote quality in line with international guidelines. We'd also like to explore a peer-led mechanism of audit particularly for services where there is no quality assurance mechanism in their country, and there's no way of doing that. And we're going to begin to recruit this group after ISSUP 2022. Now, as part of this launch, Brian said this, we've produced a draft handbook. We want to consult drug treatment providers and stakeholders on this. And the handbook is how to manage your drug treatment services in line with the key quality standards. And we can share this with you electronically if you come and give your email, and we'll try and put it on the ISSUP website. The final group of stakeholders we want to work with are patient groups or patient advocacy groups. There's a phrase in the UK that we use concerning service user or patient involvement. And the phrase is, nothing for us without us. So we want to embody that principle of patient involvement in quality and quality assurance. And we want to bring the patient stakeholders around the table. And we want to work with them to produce some peer-led resources about what is the quality of drug treatment that patients can expect, and also what their rights are. We want all of the 3 stakeholder groups to work together to feed into ICQ, because we think the way forward is partnership and cooperative work. So that's some of the work streams. I want to stress that ICQ aims to work in partnership and collaboration and coordination with international agencies, with the World Health Organization, with UNODC, with the regional bodies, and with the wider Colombo Plan family and international consortium family. We want to work together to complement each other's work and add value. Now, ICQ will post details on how you can get involved with us on the ISSUP website. There's members of us around as well, so please come and contact. We've given the room number up there. We've got an open room on Saturday morning. If you want to come and get involved with us, please come and meet us. So we're in Capital Suite Room 17A, so please come and talk to us. Now, finally, I'd very much like to thank ISSUP for letting us launch ICQ at ISSUP 2022 in front of this wonderful global audience that's in the room and also being broadcast around the world. And finally, I'd also like to thank the US State Department, INL, and Colombo Plan, in particularly my colleagues Brian Morales and Dr. Mariano Montenegro, for their vision and drive and resources to get to ICQ off the ground. Thank you, guys. And so to work.
All right. I think by this we conclude this morning session with the inauguration and launching of the ICQ, which is a very needed kind of process to all of us, involving all the stakeholders, including our patients in our decision making and setting the standards of services. And thank you for Colombo Plan for doing that along with the INL. And we are pleased that, and ISSUP, of course, and we are pleased to have this launch here in Abu Dhabi, in the United Arab Emirates. Thank you very much, and I hope you enjoy the rest of your day and the conference. Thank you.